So there's been a pretty big shakeup in Singapore's health insurance rules. And if you have an integrated Shield plan, this is going to hit your wallet directly. The big question is, what's the catch? Well, we're about to break down exactly what's changing, why it's changing, and most importantly, what it means for you. You've probably heard the headline promise of these new rules. You get to pay less in monthly premiums. I mean, who doesn't love the sound of that? But you know how it goes. There's almost always a catch. And getting your head around that catch is absolutely crucial for your financial planning. And here it is, the core idea in a nutshell. You will save some money every month on your insurance bill. That's the good news. The trade-off? You're going to be paying more out of your own pocket whenever you actually need to be hospitalized. This is the fundamental give and take we're going to dig into.
All right, let's get into the nitty-gritty of what's actually different now. But before we can really understand the new rules, there's one key piece of the puzzle you need to know about.
The part of your insurance that's really at the center of this whole transformation is something called the rider. The easiest way to think about it is like a power-up or a booster for your main Shield plan. Its job is to cover those pesky out-of-pocket costs, things like your deductible. That's the first chunk of the bill you have to pay yourself each year. And co-insurance, which is the percentage of the bill you split with the insurance company. Now, in the past, these riders could cover pretty much everything, which led to a situation some of you might remember quite well. That's right, the potential for a $0 hospital bill. It was actually possible with the old riders to have a hospital stay and walk out without paying a single cent from your own pocket. But those days are over. Under the new system, that's just not an option anymore. You will always pay a portion of the bill. So the real question becomes, how much?
The first number you absolutely have to burn into your brain is 5%. This is the new minimum copayment. It means that for any hospital bill, you're now on the hook for at least 5% of that total cost. But don't panic, that's not the whole story.
And here's the second number, which is just as crucial, $3,000. To stop you from getting hit with a gigantic, unmanageable bill, that 5% copayment you have to make is capped. You will never pay more than $3,000 in these copayments in a single policy year. It's a really important safety net to have.
So let's just quickly recap the big changes. The era of riders giving you full 100% coverage, that's officially over. Every new plan now requires you to share the cost with that minimum 5% copayment. It's a really fundamental shift in how this type of insurance works.
This all leads to the pretty obvious question, right? Why? Why make such a massive change? Well, this wasn't just some random decision. It's actually a direct response to a very serious, long-term challenge the whole country is facing.
The main reason behind all this is the skyrocketing cost of healthcare here in Singapore. To keep the entire system afloat and sustainable for everyone in the long run, the old model just had to change. Turns out, that old system was creating a pretty tricky incentive.
And this really gets to the heart of the problem. Think about it. When a medical treatment feels free because you know your insurance is going to cover 100% of it, there's this natural human tendency to, overconsume. Maybe you'd opt for a more expensive treatment when a cheaper one would do, or ask for tests that aren't strictly necessary. When you multiply that behavior across an entire population, it drives up costs for everybody.
And you can really see the result of that trend. For years, the premiums for these plans have just been climbing and climbing. If nothing was done, the projection was that they would eventually become totally unaffordable for a lot of people. So these new rules are a direct attempt to bend that cost curve back down. Okay, so we've covered the what and the why. Let's get to the part that you probably care about the most. How does this all impact your wallet? What does your new financial reality actually look like? This pretty much sums up the big trade-off perfectly. On one hand, you can expect the premiums for your rider to drop, maybe by as much as 20 to 30%. That's real cash back in your pocket every single month. But on the other hand, you're taking on a new kind of financial risk, that minimum 5% copayment whenever you're hospitalized. And of course, this trade-off hits different people in different ways. If you're young and healthy, hey, you might just pocket the savings on your premiums and come out way ahead. For families, that improved monthly cash flow can be a real help. But for older folks who are just statistically more likely to need healthcare, that copayment could become a much more significant and regular expense. So how in the world do you navigate all this? Well, I think we can break it down into 3 key financial insights. Think of these as a new playbook to help turn this challenge into a genuine opportunity. Okay, insight number 1 is really a mental shift. We just have to accept that cost sharing is the new normal. It's here to stay. The whole point is to make all of us more mindful consumers of healthcare,
to get us to think for a second about the cost and necessity of treatments. It's not just a policy change, it's really a cultural one.
And this brings us to a hugely important point. If you're now responsible for potentially up to $3,000 a year in medical bills, where is that cash going to come from? It has to be from savings you can get to quickly. Having an emergency fund with 3 to 6 months of your expenses isn't just good financial advice anymore. It's an absolutely essential buffer in this new healthcare world.
Now for the upside. That money you're saving on your lower premiums, it shouldn't just vanish into your daily coffee budget. This is a real opportunity. If you can take those savings and consistently invest them, you can start building the wealth you'll need to cover those future healthcare costs yourself. And, in the process, make your overall financial situation that much stronger.
Okay, enough theory. Let's get practical. Here's a simple, straightforward action plan for what you should probably do right now.
First things first, go find your policy documents. Seriously, you need to know for sure if you're on one of the older riders or a new one. Second, take a moment to really think about your personal needs. Is having access to a private hospital a non-negotiable for you, or are you comfortable with the public system? And finally, a big word of caution. Think long and hard before you decide to switch plans. It's not always straightforward and could mean you lose coverage for pre-existing conditions.
When you zoom out and look at the big picture, if you take away just one thing from this explainer, let it be this. The entire system is shifting toward a model of shared responsibility. It's basically a new kind of partnership between you, your insurer, and your doctors, all working to keep costs from spiraling out of control for everyone.
And that leaves us with one final thought to chew on. You know, it's really easy to look at this change and just see another bill you have to pay. But what if we reframe it? With lower premiums and a very clear, capped risk, could this be the exact push you need to finally build that robust emergency fund, to start investing more consistently, and to take even greater control of your own financial future? That's the real opportunity here.